family, a nice house, a good job. I just want to be happy.
Once you've cured your hangover, Mr. Docherty is about to start.
Madam, we're taking out your gallstone this afternoon.
Mr. Docherty, the other lady was for cholecystectomy. This one has a kidney stone.
Madam, we're taking out your kidney stone this afternoon. You all saw how I was bold or googly there. Fair, fat, female, fluid, and feces, and
Mr. Docherty gets a little confused in the mornings. Gallstones are classically associated with patients who are female, fat, fair, fertile, and 40. The causes of abdominal distension also begin with F: fat, fluid, feces, flatus, fetus, fibroids, and other tumours. Mr. Docherty, this gentleman isn't one of your patients.
I was aware of that. I thought he might be of interest to some of our new medical students. Which one of you clerked this patient? You have discovered, no doubt, the abnormality of the pulses in his legs.
Oh, radiofemoral delay.
I think we should put this young lady out of her misery.
Where you run off to, then?
No way, I'm eating Andrew for lunch.
Oh, aye. How's it going?
It's not. It's about as much fun as a smear test. All work. And church on Sundays.
Has he tried to,
No.
Nah.
No.
Well, that's not very flattering. I remember how Roy couldn't keep his hands off me. Electric. If ever there was a power cut, you just plug them into the national grid and the lights at doom real. Flicker back on.
I was given to understand you were sitting your primary fellowship examination next week.
Monday.
You should be on study leave, my dear.
I applied for it, but
Go on.
Mr. Betancourt declined my application because he wasn't happy to have a locum cover his take tomorrow.
I suggest you commence study leave immediately. If Mr. Betancourt is dissatisfied with the locum, he can swap takes with me. I don't know how anyone can be expected to gain postgraduate qualification in circumstances like these.
Thank you, Mr. Docherty.
Just one more thing. When Mr. Betancourt turned you down, why didn't you come to me? Ah, it's an awful thing I've done. Growing old. Wasn't planned, I can assure you.
I believe the locum again. Still no answer. We're on take, and Monica, the SHO, is away taking a primary FRCS.
What does on take mean?
It means we have to take even more crap than the usual vast amount that we normally have to take. To complete the following saying, listen to the patient.
He's telling you the diagnosis.
Raj's law is don't listen to the patient. They're telling you a load of crap. Ask Mr. Gittins how far he can walk before his legs hurt.
Mr. Gittins, how far can you walk before your legs start to hurt?
Not far.
And how far roughly is that?
No farther than the bus stop.
How far is the bus stop?
down the road and round the corner.
100 yards, a mile?
Well, I'm funny, me, because I walk faster than most.
Notwithstanding your amusingly rapid gait, how far can you walk before your legs start to hurt?
Not far. Now, my neighbour...
Thank you, Mr. Gittins.
Andrew, have you still not done those TTOs?
Exactly, I'm top form today. It's just...
And you know you didn't fill in any KMR1s for last month's admissions?
Sorry, I had to. Oh, these will take ages.
Sister Alison called in sick for the late shift. And Claire's reviewed Mr. Cross and the central line can come out.
Well, Andrew will have to do it.
I wouldn't know where to begin.
I did it loads when I worked in ITU.
Yeah, that was a different health authority. You wouldn't be covered to do it here.
Clearly, the laws of nature alter from one health authority to the next. If you've done it before, maybe you could show me what to do. It'll be my responsibility.
Dr. Raja, this is Dr. Patel, our new locum.
I am having trouble with my bleep.
Sure, there's a few things on the ward round, if that's okay.
First, I must have the keys of my room.
Porter's Lodge.
I'll show you where it is. Come this way.
No way am I going to end up like that.
Hello, Dr. Raja. Oh, Mum. Not now, Mum. Yes, I know it's thanks to you that I became a doctor. There's not a day goes by that I don't want to thank you for talking me out of becoming an accountant. No, I've not seen a picture. Yes, I'm sure she's pretty. No, I don't want to marry her. Mum, let me summarise. Doctor, yes. Arranged marriage, no.
What a jerk.
Once the stitches are out. Tug the line. And then you apply pressure. That's it.
Right, it doesn't take... It's all right for me. I've taken Mr. Crowson's central line out, Claire.
No great shakes, as long as you lie them flat to reduce the risk of air embolism.
Actually, Claire, I'm feeling a bit rough today.
What's that word there, front of your name?
Doctor?
Right. Doctors don't take sick leave. You'll be dead on your feet, but you're still coming to work, else you'll be dumping on your colleagues to cover. Just because you're going out with a nurse doesn't mean you have to turn into one.
When you take out a central line, you lie the patient flat to avoid killing them with an air embolism. Oh, Caroline.
Raj, I thought you might want to take a look at this drug chart that Dr. Patel's written up. I've tried bleeping him 3 times already.
Leave this with me.
You know, that Dr. Patel hasn't done a stroke of work since he got here.
Western Australia is quite right.
Dr. Patel, we've been trying to bleep you.
I'm sorry, my bleep is...
It'd help if you had it switched on. I can't quite make out the drug at the top of the page.
It is a diuretic.
Which one?
There are very many, as you know.
Frusemide?
Frusemide, that is correct.
You've written the intravenous dose as 1 tablet. Tablets aren't given IV, Dr. Patel.
That is a silly mistake on my part.
So what dose do you want the patient to have?